Thank you for the nice introduction, and it's a real honor to be here in front of so many people who I've seen had a wonderful conference, and I hear that you've heard a lot about and talked a lot about AI. And I'm sure that you've also kind of throughout these last couple of days heard a lot about what AI can do, how it can optimize healthcare, how it can work almost like a silver bullet in many areas of healthcare. So, of course, that is really the big question here, because many of the promises that this technology provides, and many of the people that are telling us how fantastic this technology is, well, it really depends on what kind of path we choose right now. Right now, we are at a crucial moment. You can probably a few years ago when you went to this conference, there was not a lot of talk about AI, but now, just within the last couple of years, it's been exploding. The conversations, not only the conversations, but also you feel it in your everyday life. You've tried it yourself. Probably generative AI, many have tried, some are starting to use it in their work, but also kind of in the infrastructure of your work, you realize that there are more and more functions that are being implemented in your everyday life. So what I'll talk to you about today is something that I've been working with for the last, I would say, almost 10 years. So first of all, we can talk about laws and standards. So one of the things that I did was I was in the high-level group on AI that developed the ethics guidelines for the EU's implementation of AI that kind of became the foundation, or they did become the foundation of the AI Act, for example. So there's many ways that policymakers and the standards that we see in our work and the regulations are addressing some of these new technologies and these transformations in our everyday life. And one of the things that have really been developed, in particular in the EU, but also internationally, I'll get back to that, is the idea of a human-centric approach to artificial intelligence. So there's the laws and there's the standards, but what I really want to talk to you about is really also what kind of values, what does this mean in reality, the human-centric approach to AI? What kind of values and priorities do we need to implement in our organizations, do we need to promote in our organizations and in our everyday life to really achieve the kind of artificial intelligent future that we're being promised at the moment? So I think that with this, you've heard a lot about all the different ways that artificial intelligence can be used for in healthcare situations. So there's so many opportunities in this for diagnostic and prediction-based care. You hear about how clinical care is moving from the hospital and the clinical setting into the home. You have AI used for prediction of diseases, AI used for health research, for health care management and planning, for disease prevention, and also in the moment when we have emergencies and crises. So if you take something like management, and I'm not only talking about management in healthcare situations, but actually if we look around in our everyday life, in the way in which organizations are being managed at the moment, within just a few years, what we call algorithmic management has really been introduced in a large way, not only in the most obvious places where we would think it would be, for example, in the United States, where AI has really been introduced very early in these settings, but also in Europe and in Scandinavia. So algorithmic management is really something that's been introduced. And if we look at management in general, so think of historically how, for example, managers were dealing with in think of the 1920s, managers were dealing with the factory. You would have this kind of idea of using machines, having physical settings, having to manage machines, managing human beings as almost like bolts in the machinery. But now, as I just said, algorithmic management or the organization has moved into this more human-centric idea. So algorithmic management, what does that mean in general? Well, we can think of ways of, for example, restricting information, providing information for doctors in a healthcare situation, helping them making decisions. You can think of ways of, for example, supporting and rewarding personnel. You can think of it in a way of using it for allocation of resources. There's all these kind of ways that algorithmic management is being used at the moment. The problem is that we often see, and this is not only in healthcare situations, it is that all these intentions that we have, and that I'm sure that you've also heard about, all the ideas about efficiency and optimization, all the ideas about what we can do in terms of allocation and coordination and prediction and sharing knowledge within an organizations. These 6 R's that I showed you before, unfortunately, the way that we see it at the moment, the way it's being implemented, is very much the human experience of it is very different from what the original intentions are. So moving from this idea where we are machines and humans as part of this machinery, moving to a more human-centric organization, in many cases, and the way we look at it today with algorithmic management systems, unfortunately, this is not the way it's being implemented. So for example, in Scandinavia, but generally worldwide, algorithmic management systems are not really implemented and with the same consequences as the intentions are. So this is, for example, a survey conducted just a few years ago with 6,000 people from unions all over Scandinavia that basically shows that all these intentions about algorithmic management systems, all these promises, are really what they are creating is distrust. So when we think about artificial intelligence and what it can do for our organizations, a lot of the promises are really based, and these ideas and narratives that we hear at the moment is about optimization and efficiency. Our organizations will change, the healthcare systems will basically achieve ultimate optimization and efficiency within a very near future. So for example, take something like AI symptom checkers. A lot of this moving from clinical care to home care is being implemented with tools like AI tools that, for example, function as filters. So if you sit at home, these are used to, for example, you tell a system, an AI system, that these are my symptoms, and then the optimal solution would be that this AI system would be able to actually detect what kind of, for example, if you have appendicitis. So you are recommended a certain treatment. You go to the hospital. Unfortunately, many investigations shows that these AI system checkers and these different checkers for symptoms are really not working as they should. And most of the times they're implemented in a way that where you are promised certain things and you simply believe that this is the silver bullet to the problem that you have at hand. So what is really missing in these situations? So first of all, we are promised some things about our organizations, about the society that we're living in. What can AI do for us today? And many of these things would probably be achievable. The problem is that many times there's something fundamental missing in a situation like this. So think about an AI symptom checker. So how many times would an AI symptom checker, for example, make a wrong judgment in terms of if it's appendicitis, for example? So you say that your stomach is hurting, but there's things that this system cannot see and cannot do. The subtle cues, like the movement in the chair that you make because you are sore in one side of your body. The human care, the situations, there are unfortunately things that this system cannot see. And unfortunately, in the sense that I'm saying that there are things that are promised within these systems that are not considered relevant. So in the entire history of artificial intelligence, there are things that are being promised, things that we are told that can be replaced, unique human qualities that we are told that these can be replaced by systems. So think of something like our creativity. Right now, it's very difficult to think that, for example, that in the future there will be a space for and a room for an artist or a musician. Because if a system can create a perfectly sounding song or make a perfectly human sounding piece of literature, what is it that the human artist can do in the future then? Think about intuition, something like the human intuition that is incredibly important in a healthcare situation. The subtle cues, the understanding of the situation, the embeddedness of a healthcare provider, for example, or professional. All of these things have been promised since the beginning of the history, all the way back to the 1950s when we were creating systems and creating the very term artificial intelligence. We were promised that these things can be imitated, replaced, and designed. Now, as I said, there's laws and there's standards and there's shared principles that are really based on the idea that this is not the case, that we do need a different kind of approach to human beings, machines, and society in general. So right now, at the moment, we have some conversations, ongoing conversations, and they've been going on for a while since as I said, I was in the high-level group on AI. In 2018, we developed the ethics guideline for trustworthy AI. At that time, we were told that artificial intelligence would be also the silver bullet, the solution to all our problems. But the EU actually took a different approach, looking at what comes first. What is it that we want to support? And what is it that we think that artificial intelligence can achieve with the human in charge, with human responsibility, and with human dignity at the forefront? And so within the last 10 years, we've had negotiations internationally. The UNESCO has the AI principles with the foundation of the human-centric, in the human-centric approach to AI. OECD has AI principles. Several intergovernmental organizations and countries all over the world has been creating principles, all basing their initiatives on this idea of the human-centric approach to AI. And what does this actually mean? In reality, what it means is it is an affirmation that none of these systems that we are implementing in our everyday life can really stand alone. They are reaffirming that fundamental rights and human rights, the agreements we have among countries in the world, among intergovernmental organizations on fundamental rights, on human rights, is the foundation for systems like this. And in the EU, there's actually a very long tradition that really emphasizes this principle. So if we go all the way back to the 1990s, and this is, of course, the Council of Europe, which is much broader than the EU, we have something like the Oviedo Foundation or the Bioethics Convention. And we have moved since then, based on this principle, that what we should really emphasize is the interest of the human being as the core interest that would always not compete with, but would always be stronger and prioritized rather than only social or, for example, industry or scientific interests. If we look at the ethics guidelines that we created in the high-level group on AI, what they really showed was also that this idea of the human-centric approach to AI is something that is really also implementable and practical in very concrete ways. So we developed 7 principles that are all based on this idea of human agency and oversight. This is the first principle. These are translated into a tool, so if anyone is interested, it's called the ALT-I tool, which each of them have a set of questions. Here I only have some questions, but a set of questions that makes it implementable in a situation where you want to either implement an AI system or develop an AI system. So for example, in the context of human agency and autonomy, the very first principle, there's a question of how you actually deal with the human being in the situation where, think of, for example, a diagnostic tool. Do you have oversight as a healthcare professional? Do you feel that your own expertise is relevant in the situation, or is it overruled by the suggestion by the AI system? So these are all, the principles, the standards, the legal frameworks. We can think of them as almost in the terms that we can put a checkbox. The compliance frameworks that we have to adhere to, and luckily we see that the standards and the legal frameworks are really in place in many places. But rather than, we can think of the human-centric approach and these legal frameworks as something we just have to comply with. But if we think of it as just a checkbox exercise, then what is it really we are achieving? So this is where we get to the point of the values. What is a human-centric approach in terms of values? Well, in reality, it goes back to this idea of the human in the center. So think about the moment when a system is being implemented, when we either purchase the system, implement it, adopt it. Who does it benefit? What does it benefit? Is it an idea of a management to exactly, we're told that this is optimizing a situation, it's efficient, it will create resources and make everything easier for us? Is it a healthcare provider? Is it really benefiting the patient in the very end, like the symptom checkers? Or is it really just a question of profits and markets? And for what purpose? Is it for optimizing, as I said? Is it for collaboration? Is it for human well-being? Or, and this is a really important point, getting back to that we can almost really smell in the air of any conference or any organizations we are in right now? Is it just for the sake of the technology? So right now, we have this almost belief in a technology. We're told that there is this silver bullet, there is this goal in the future where artificial intelligence would somehow not only achieve all our goals, but it will also surpass the human capacities. In 2021, I went to the Expo Dubai. It's really the world forum, the World Exposition. We went there as a delegation with the EU, and I go into one of these fantastic places where one nation can show their excellence in technology, and we're all 4 or 5 people moved into this elevator, and I reached to the button, and some guide, he's like, "Oh no, please don't push that button because this elevator has voice recognition." And so we're a group of people that are standing there in this elevator waiting, asking the elevator to go up like 3 floors, or not even 3 steps up, and nothing happens. Until the very end, this technology, it understands our voices and it takes us up those 3 floors. Why is it that I didn't just push that button? Why is it that I didn't just walk up those 3 floors? Well, in reality, it's because I'm told and I'm promised, and there's something fantastic and extraordinary about this technology. And that's what I mean with what kind of purpose is it that we are implementing these technologies. And so when we really get to the point is really, when we talk about the human-centric approach to artificial intelligence, are we talking about humans in the loop? Humans that are not following their own needs or their own qualities or their own inclinations? Or are we really thinking about creating technologies where humans are in command? And right now, unfortunately, when we talk about healthcare situations, these are often situations that are characterized by emergencies, for example. And what I see a lot in the healthcare situation, but not only in the healthcare situation, the biggest pressure on the human-centric approach is really this pressure that comes out in emergency situations. So think about, for example, during the pandemic, artificial intelligence, that's really where it had its glory moment. The systems that were developed and pushed into the market immediately for triage, for surveilling the movement of the pandemic and the disease, for all kinds of things, vaccination development. And while some of these systems were working, many of them were also implemented really fast without ethical assessments, without impact assessments, and showing that in some situations, for example, in terms of the screening tools that we were presented to, often did not work because they were implemented too fast. And the problem in situations like that is, of course, that if you implement a system like that without the human dimension, without the human-centric approach, without understanding the welfare and the fundamental rights implications, the implications are grand. You probably, I don't know, you come from all over the world. I myself, I was locked in a small flat in one country in Europe. And a screening tool like this would, for example, keep me in place. So our mobility, our different ways of interacting in the world were impacted by this. So my point is here, what is the human-centric AI approach? What is the approach to AI that we really want? One thing is the human-centric laws, the standards, where we really have principles now that are being implemented. And for example, in the EU AI Act, most healthcare AI, or all healthcare AI, would be high risk. So there would be the fundamental rights impact assessments, there would be the impact assessment, there would be all the different kinds of documentation that you need. There are requirements to these systems. But another thing is, as I said, the organizational and the culture around how the values that we implement these systems with. So if we go back to the 7 qualities that I showed you before, all of these qualities that are considered noise in our everyday life because of this kind of promise about artificial intelligence that can replace them, then there are really some really obvious ways that these qualities can be used to guide the development of artificial intelligence. Again, creativity. How would you replace the creativity in a healthcare situation? The creativity of clinicians that are suggesting novel treatments. Try to replace the emotion in a healthcare situation with, for example, an AI screening tool. Try to replace the understanding that a healthcare professional have of a situation, a patient they're sitting in front of, the culture of the patient, the life, their situation in general. Replace the intuition. Think about replacing the love and the care. There's nothing that compares with that. And then, of course, defiance. There are moments where systems like these would never in any way be able to do the same thing as a human being can do in a moment of injustice or things that are done wrong. And then, of course, the last thing, we're promised that artificial intelligence somehow will reach and outcompete human intelligence sometime in the future. But then let's ask, what is human intelligence really? Is it just processing large amount of data? Is it just storing large amount of data? Or is it in reality not something else? Isn't it just the experience, the integrity, the cultivation of knowledge, the sharing of knowledge, the education of knowledge? And with that said, let me just say thank you, and I hope you enjoy the rest of the conference.